All units, please respond. We have a 1046 at the Burgoyne Bridge.
There's countless people that have been affected by that bridge. People were scared to drive under it. People were scared to walk over it. It was something that needed to be addressed. My name is Wendy Duggan. I'm the president of Niagara United, a nonprofit organization that promotes mental health and suicide prevention. The last couple of years with my spouse were very hard. We had got lots of diagnoses. We had tried to work through the system. So you can make an appointment. 2 months from now, he might not be able to go. You miss that appointment. We're back to square one, start at the beginning again. That had gone on for about 4 years of our life. This was a 19-year-old boy. He ended up on that bridge. He ended up being affected by his mental health to the point where he lost his life. It let us see how our system was failing and how many ways it failed in that one day. And I thought, you know what? I need to do something. So we went out and we took the kids to put the notes on the bridge. That's how I got involved. From that stemmed the whole newspaper articles and my post going viral. And there was enough people that were contacting and enough people that were sharing that post that clearly this was not just an issue for me. And we had decided that a rally was needed. There was enough people that were angry and wanted some kind of change. So we joined together and did that. Nobody ever thought that that many people would show up. That's when we decided to start Niagara United. There needed to be a united front to make sure that mental health and suicide prevention are things that we focus on as a community because we're losing each other.
The Burgoyne Bridge has become synonymous with this is where you go. My name is Laura Yip, and I'm a regional councillor representing St. Catharines. I think anyone who lives in St. Catharines knows that the Burgoyne Bridge has always been a problem with respect to people dying there. For whatever reason, when the new construction took place, it became quite a magnet. Then it was really this term of council, 2018, when it really started making, headlines. I got up at Public Works Committee, and I did it the following week at Regional Council as well, and told committee my own experiences with mental health and my sister's experiences with mental health and why these barriers were so important. Our medical officer of health had provided us with, in that one meeting, it was an 80-page report of why the barriers were important and what the barriers would do.
How many people dying at this location is enough people for us to decide we will do something where we can. Barriers work. They are the most effective method by which to prevent suicide by this means. The evidence demonstrates that people don't simply move. In fact, the overall rate of suicide decreases. So I implore you to realize that, in fact, staff are the experts on this issue. Please support their recommendations and play a role, frankly, in saving lives.
There was resistance in that regard, that people thought that this could just be solved by well-meaning people in the community. There was a lot of resistance, again, to the data that was being provided to us by the medical officer of health. We had regional counselors saying, you can make the data say whatever you want it to say. And there are a number of counselors who just decided, even in the face of hard evidence, I don't believe it. We have a number of resources. The challenge is always, there are never enough resources, right? So although all of the people who work for those agencies are doing the best they can with what they have, they're doing the best they can with what they have, and what they have isn't enough.
I'm supposed to take a course for bipolar disorder, which only runs Fridays at noon. So for me to take that off of work, it's just not feasible. They don't work with us, we have to work with them. I received a message to join this group, which was Niagara United MAPS, so I went out to that, and then I learned that they were doing more things with the bridge, and that's when I got involved. For me, it was like a sign of hope, because I know with my mental health, there's days where I don't feel like anybody's out there to help me. I just feel like a lost soul at some points in my life. And just knowing that there's a group of people that cared and that are willing to fight for the people that can't fight for themselves was a huge thing for me.
I was talking to every family member. I was talking to their brothers, their sisters, their moms. Because of that little lack of not having those barriers, there's people that had to bury their children, and that's sad. That we failed. I was fighting my absolute hardest. It's heartbreaking when you're trying your best to stop something, and it just can't stop. It was determined in our mind that we couldn't end until there was barriers on the bridge. That was the end goal for us. So that's what we did.
The final decision to put the barriers in place was April 25th, 2019. If the barriers had been constructed at the same time as the bridge was being reconstructed, for a number of reasons with respect to design, engineering, the actual construction, the barriers would have cost less than installing them after the fact. If the previous term of council had done what many of us think they should have, they would have built the barriers at the same time as reconstructing the bridge, and we never would have had this issue. We passed a motion that said we will consider social determinants of health in all of the rest of our decision-making from now on. If we were considering those things in the decision-making with respect to the infrastructure, those barriers would have been placed when the bridge was reconstructed. I don't care if barriers only save one life. That's worth the cost of the barriers.